Hey guys, I'm going to talk to you a little bit about bariatric surgery. I'm not a big fan, spoiler alert, in case you were wondering, not a big fan of bariatric surgery, which is a change because when I was in conventional medicine, I was having a lot of failures with nutrition and exercise, and I frequently recommended bariatric surgery because I thought it was one of the only ways we could get people healthier. I knew that diabetes and high blood pressure and high cholesterol were causing damage and killing people, and bariatric surgery was one of the ways to lower the weight and reduce those diseases. So naturally, I thought I was helping people. But that was really before I started looking into nutritional changes, lifestyle changes, giving people the right food plans, individual food plans for them, nutritional supplements, vitamin optimization, hormone optimization, and really it's so much easier to get people to the health goals that they want. We're not necessarily giving everybody six packs around here, but we're at least getting them healthier, and we can reverse their diabetes and cholesterol problems without cutting their bellies open. So you may not know much about bariatric surgery. Bariatric surgery, there's several different types. The most popular one right now seems to be the gastric banding, which is where they literally take like a rubber band, wrap it around your stomach and pinch it off. And that way you get the sensation of being full quicker, and then you just won't eat as much. It doesn't change the foods you're eating necessarily, because basically you start to learn which foods make you less bloated and less distended. Because if you think about it, if you have a small stomach pouch because of this band, but milkshakes don't really make you full because it's already liquid and they're delicious and they just go right down and they're pretty much sugar. So gastric bands are associated with a high failure rate, because if you eat salad and you get full really quickly, but you're hungry again, then that's not really working. But you can drink milkshakes all day long and your stomach feels fine and your calorie consumption is way higher. So gastric banding is not very successful, and people generally only lose 10% of their body weight and then it stops. That might be enough to reverse diabetes and cholesterol, but you're trading in open abdominal surgery for, although most of it's done by laparoscopy nowadays, you're trading that instead of just better nutritional changes. The most effective bariatric surgery is called a Roux-en-Y. I think it was created by Dr. Roux or something. But the idea is that they're rerouting your bowels. Typically in a Roux-en-Y, they're clipping a piece of your stomach, making the stomach smaller, so a gastrectomy, and then they're reconnecting your bowels. They are detaching your stomach from your duodenum, which is the next part of the small intestines. Right after food leaves the stomach, it enters the duodenum. It's your small intestine. And they're attaching it to the jejunum part of your intestines. And basically, they skip about 12 to 13 inches of intestine. And the idea is your stomach is smaller, so you can eat less food and you're fuller faster. And two, whenever your stomach does empty food into the small intestines, you have 12 inches less of time to break down your food and absorb your food. So naturally, less food gets broken down and absorbed, less vitamins and nutrients have time to get absorbed, and then those vitamins and minerals and nutrients end up dumping in your large bowel. And by the time it gets to the large bowel, you can't absorb those nutrients, so you just have looser stools, fattier stools, and basically you're just kind of pooping out calories. So that's a pretty aggressive surgery. You are rerouting your intestines for the rest of your life. And many of these people after bariatric surgery, yes, they're losing tons of weight, but they feel terrible. They're fatigued, they're exhausted, they're missing crucial vitamins, minerals, and nutrients. And people forget that we don't know everything about vitamins and phytochemicals and nutrients and plants. So we know the basics. We know about manganese and zinc and selenium and vitamin A and vitamin D. We have all those in a multivitamin, but there's tons of phytonutrients in plants and oranges and apples that we can't analyze. We can't put in a multivitamin. It's impossible. And so if you can't absorb all those micronutrients, then you start feeling like crap, the FLC syndrome. And so bariatric surgery has become a common answer for conventional medicine to, oh, okay, well, you're not losing weight with the recommended low-fat diet, then it's time to go to bariatric surgery. If we had the right food plan to tell people, a Mediterranean-style food plan, high in fat, high in vegetables, let's make good food taste good, then we wouldn't need these interventions, because people would feel fuller, they would feel better, and their system would be fed with good vitamins and minerals. So I'm not a big fan of bariatric surgery. I don't think it's God's send to America as far as curing our obesity population. It's definitely fattening some surgeons' pockets. Not that it's their fault. They're trying to offer something that people want, and it does help people get to some of the goals that they're looking for, but it's not the best answer. So I'm talking about this because I got an article a couple months ago, and it came on my list of videos to do, and it irritated me. I'm disappointed. To be honest, I don't even know what their goal was to doing this study. So the study was bariatric surgery versus intensive medical therapy for diabetics over 5 years. This was in the New England Journal of Medicine, which is one of the most renowned, if not the most renowned, medical journals that we use. And this was published in February of 2017. So brand new, only a few months old. And basically, their outcomes were, or let me tell you a little bit about it. So it was type 2 diabetics that had an A1C over 6%, so obviously diabetic. And they put them in two different groups. One group got Roux-en-Y, which I talked about earlier, is the complete rerouting of your small intestines and a piece of your stomach's cut off, compared with intensive medical therapy. So intensive medical therapy is obviously slacking because at the end of the study, at the end of the 5 years, more people had reversed their diabetes and gotten healthier with bariatric surgery. So the outcome of this study is that if you're diabetic, you do better with bariatric surgery than you do with lifestyle modification. That hurts me to tell you that. Because if you took that study to the bank, then you'd say, well, if you're diabetic, you'll live longer with bariatric surgery. But maybe, just maybe, the intensive medical therapy was not the right therapy, because I think the take-home message for me with this study is whatever they were doing in the intensive medical therapy, which is usually, don't eat these foods, and here's some weight loss medications like Qsymia or Belviq or any of those medications, and let's see how you do. They probably didn't follow up with a nutritionist that was talking about high-fat foods and balancing testosterone and giving vitamins and minerals, because they did worse than the bariatric group over 5 years. Over 5 years, someone should easily be able to reverse their type 2 diabetes. It doesn't take much. You eat a high-fat diet, really low in carbs, and your insulin sensitivity resets. You enter a ketogenic phase, which means you're eating high fat and very little carbs, less than 20 grams of carbs. Your body enters ketogenic phase. It's almost impossible to be diabetic when you are ketogenic. In fact, I think it actually is impossible to be diabetic with you being ketogenic. So if you've got type 2 diabetes and you're considering bariatric surgery, stop. You're following the wrong nutritional guidelines. If you can't get healthier doing what you're doing the wrong thing. You do not need bariatric surgery. You do not need a drug. You do not need a pill to lose weight. You need food. You need to eat a whole foods, plant-based diet that is high in fat. For people that are type 2 diabetic, I normally tell them eat as much fat as you want. I don't care if it's bacon, sausage, eggs. Eat as much fat. Anything that you can find that's fat, great. Let's reverse the diabetes. That's not a good long-term plan, but let's reverse the diabetes. Once the diabetes is reversed, then we can start working on getting more carbs into the diet, varying the diet some more, but first step is to get the diabetes reversed. Of course, I want them to eat plenty plants. I want them to eat a whole foods diet, but in the beginning, it's all about reversing the diabetes. So what is a whole foods diet? What does that mean? When you think whole foods, I want you to think not when you're going to the Whole Foods grocery store. I'm thinking that when you're going to the grocery store, you are buying foods in their natural form, meaning if you're buying an apple, someone picked that from the tree and put it in the basket and you're buying the apple. Not apple sauce, not apple juice, not apple crumb cake. It's apple, the whole food. Okay? If you're going to buy eggs, you're not buying egg whites that are already in a container, you're buying the egg and you're eating the whole food. Generally, you should be buying only whole foods and preparing the foods on your own. That is the way to reverse diabetes. Even if you don't go ketogenic and you don't drop your carbs, if you're eating a whole foods plant-based diet, you can pretty much reverse your diabetes. Plant-based is just saying that the majority of your food, when you look down at your plate, should mostly be plants. So if you've got a plate this big, your meat should be a small percentage of it, maybe 30% of the plate, and the rest should be vegetables. Not potatoes, because that's the easy answer. Not potatoes, not high-starch foods, not rice. You want vegetables. You want green stuff, yellow stuff, blue stuff, purple stuff, all the colors of the rainbow. You want a whole foods plant-based diet. I bet that if we redid this study and we took patients that were in my practice and talking about whole foods and working on nutrition and compared those to the bariatric surgery, we would have quicker results, faster results, and people would feel better. If you're considering bariatric surgery, Go outside of the box, talk to people that are years after bariatric surgery and ask if they would do it again, and talk to multiple people, because I have seen people that did really well with bariatric surgery, but I've also seen a ton of people who feel like crap after bariatric surgery. Yes, they dropped 100 pounds. Yes, they can fit in clothes they never could fit in before, but they feel terrible. Yes, they reversed their diabetes. Yes, they reversed their high blood pressure, but now they can't get off the couch because they just have no energy. If you're overweight, if you are obese, there is metabolic disturbances that is going on in your body, and you need a functional medicine doctor to help you analyze those, rebalance those, optimize your hormones, optimize your vitamins, and your body will naturally lose weight. A healthy body is not an overweight body. We don't focus on a lot of weight loss in my practice. We focus on getting people healthier, optimizing their body, and naturally people start to lose weight. We saw a patient earlier today who, before she saw us, she had done an intense boot camp program for 10 weeks, and she gained weight on it. She gained weight on an intense boot camp. She pushed herself to the brink of exhaustion doing it. What did we tell her when she came in? Stop exercising. That's not how you lose weight right now. You need to stop exercising. Just do some stretches, light movement. Let's eat some good foods. Let's remove gluten and dairy. We just saw her today after 1 month, and she's lost 10 pounds. 10 pounds. And she did less exercise. The American population and the American companies will tell you that the way to lose weight is to eat less and exercise more. It's all about calories in, calories out. That's nothing but a lie. Your body adapts to the amount of calories you eat, and it also adapts to the types of calories you eat. If you're eating a high carb diet, hamburgers, french fries, potatoes, rice, then you're packing on the insulin, and insulin is triggering your body to make more fat cells. Eating fat does not cause you to gain weight. Eating fat is the way to lose weight. It speeds up your metabolism. Insulin is what triggers fat storage. Insulin is only triggered by sugar. Now, technically, it's slightly triggered by saturated fatty acids, but that's just a minor point. The majority of trigger to insulin is carbs. So any source of carbs and sugar is a trigger for insulin, and insulin causes weight gain. Many people, the first time they come in, I ask them if they're eating too many carbs and sugar. They're like, no, I don't eat too many carbs and sugar. And then I find out they're eating french fries and hamburgers and potatoes and all that. And it's like, those are carbs. A carb is a sugar, and a sugar is a carb. They're the same thing. To your body, they are the same thing. Of course, high fructose corn syrup is worse than anything on this planet. You should never consume it. But carbs are still sugar, even if it's not high fructose corn syrup. I heard a scary fact that something about 20% of the calories that Americans eat come from high fructose corn syrup. That's scary. That immediately causes weight gain. So I'll end my rant there, but I do want to tell you that bariatric surgery is not the answer. This study is not the answer. You can do better with eating a high-fat, whole foods, plant-based diet. You can't outrun your fork. Don't expect exercise to get you to your goals. Many people have adrenal dysfunction, and exercise just makes that adrenal dysfunction worse. If you don't know what adrenal dysfunction is, go on my website, oubmedical.com, O-U-B-R-E medical.com, or look up some of my other videos. I even talk about my own personal battle with adrenal dysfunction. So I'll end the rant there. Whole foods, plant-based diet, high in fat, low carb, and you can beat bariatric surgery patients. I hope this helps. Tag someone, share it with someone you think that might benefit from this video, and let's keep changing the world, guys.